Hello and welcome to Niaga Spotlight with me, Tamina Kauschi. Niaga Spotlight goes through the week in business and future affairs. Market watch, industries, analysis and insights. We've got you covered right here on Niaga Spotlight. Well, today on analysis, we are taking a look at the medical care and the healthcare sector, looking at shortages and costs and how exactly we can go around managing them. Now, it's very interesting to note that the MOH did receive one of the largest allocation increases under the budgets as of recently. Personal healthcare expenditures in Malaysia are also forecast to double to by about 13.2 billion ringgit by 2028. The National Healthcare Service, though, is experiencing continued acute shortage of medical staff and patient overcrowding. This, however, has led to a private popularization in private primary care services, such as private clinics, which offer convenience and fairly affordable prices. In fact, as of 2022, there were more than 9,800 registered private health clinics. Dr. Azizan Abdul Aziz, who is president with the Malaysian Medical Association or the MMA, joins me now in the studios to discuss managing healthcare costs as well as shortages. Dr. Azizan, such a pleasure to have you with us in the studios. How are you today?
Fine, thank you, Tamina. Thank you for inviting me.
Not at all, fantastic. So let's perhaps begin, Dr. Azizan, with painting the scenario in the public healthcare sector. We've been reading a lot of reports, particularly coming out as early as late last year, of course, on the tail end of the COVID pandemic and all the increases in demand for healthcare. Doctors, junior doctors, everyone in the medical sector have been working 30-hour and above shifts. What kind of an impact is this having on the ground at the grassroots? Please tell us more.
Working 30-hour shift will definitely leave the healthcare workers, especially doctors, physically and mentally exhausted. Mm-hmm. Yes, and it will disrupt their work-life balance if it happens too frequently, I would say, right? So the significant implication of that affects their personal health and quality of care they provide as a result of this would be my primary concern would be the physical exhaustion that they are feeling. Yeah, they get severe fatigue that can impair their motor skills, reduce their physical stamina. This will increase errors and accidents. We also read during the COVID time and all that, right? The doctors involving in car accidents back from work and all that.
That's right. Yeah, and I also do remember that there were a couple of recent cases of, unfortunately, infants who were left behind in cars. Right. At least 3 of them happened to be female healthcare workers. So understanding the burden of especially women as well, juggling their healthcare careers as professionals, as well as their duties and some of the unpaid care burden of being a mother, right?
Yes. Yeah, that's very good. Of course, with chronic fatigue, if this goes prolonged,
that's right,
it will contribute to long-term issues. That means the doctors, can develop cardiovascular diseases, high blood pressure, heart diseases, and musculoskeletal problems with such long hours, increased stress. Of course, that will lead to lots of diseases. Then the sleep deprivation that we are talking about will impair their cognitive functions, meaning their memory, decision-making, and attention. So this will also increase medical errors.
Exactly. And ultimately what we are looking for is more of a sustainable healthcare system, which not only provides for optimum patient care, but at the same time for optimum sustainability for the professionals themselves. And what have you been hearing from the thousands of members of the MMA from around the country, especially over the past 1 to 2 years? What is the sentiment, particularly amongst those who are a little more junior, Dr. Azizan?
You mean to say the contract doctors, the junior doctors are the contract doctors.
That's right.
For that 7 years. Of course, what they are saying is the working hours, right? They're talking about the working hours, the working conditions, and then the uncertainty of where they are heading, because some of them, they would like to do their postgraduate, and then they're not sure whether they're able to, because we've got the contract doctors are given like 7 years, so that wouldn't have ample time for them to complete their postgraduate.
So it ultimately is perhaps speaking towards wider systemic change perhaps that we require. But we will get into that in a little bit. Perhaps can we move now into Dr. Azizan, talking about the fact that Minister of Health, Dr. Zulkifli Ahmad, he'd announced back in April that Putrajaya is finalizing the study of a proposal for a health service commission. Your initial thoughts on this are based on what we do know insofar. How do you think it will be able to help, especially looking at the fact that we're dealing with overcrowding across the sector?
I'm grateful that the YBMK is saying about Health Service Commission, which I think is high time already, for the healthcare workforce distribution and planning, to reform the health sector. So MMA from the start already has been saying to MMA, we need this active dashboard, that sees, real-time data on the movement of doctors, how many doctors you need in a particular health facilities, what facilities you need there, how many patients, that goes to the emergency department or which particular department, so that you can strategize and plan to put, we need how many healthcare workers in that particular healthcare facilities.
Right.
Yeah, so we've been talking about it, so this also will address maldistribution, because the maldistribution will contribute to these long hours again, when that healthcare center hasn't enough doctors or nurses or other healthcare workers, then they'll be stretched to do long hours. So that will really impact the quality of healthcare and patient care.
Exactly. So what it does sound like is that an automated dashboard, which ideally would have a nexus in each and every public service health service center, that would actually be perhaps how challenging, but at the same time how beneficial to set up, in your opinion?
I think with digitalization here, I think everything is at your fingertip, I think.
That is true. So it's interesting that intra-hospital, at least even in public health, we do see increasing amounts of digitalization. It's all about having perhaps a national task force, right?
Yes, I agree. I think yes.
Okay, so moving along from that idea, let's go into perhaps looking at MOH data as well, coming back to the issue of housemen, right, at the health ministry. So we've actually seen a shrinkage of about 50% since 2019, following a drop in medical graduates. Let's also focus a little bit on perhaps this has something to do with studies being truncated during the pandemic lockdown years, before we go deeper into detail.
Right. So, so there is a drop, right, in the medical graduates. So if you say whether it's being attributed from the COVID, my short answer is yes, right? So I'll just elaborate more on it. So the numbers of housemen, it peaked at 6,319 in 2019 and 4,924 in 2018. But post-pandemic figures, it dropped to 3,245 in 2022 and 3,265 in 2023. So the decline has affected houseman training with this reduction.
Understood.
So the drop in medical graduates in Malaysia post-pandemic can be attributed to several factors. One, of course, is the contractual issues and job security. So they are discouraged, many from pursuing or continuing their careers in medicine. Because, when I say, being a doctor is going to be a contract position, so some might not even want to take up medicine.
Correct, exactly.
Right? So the contract doctors in Malaysia have expressed their frustrations over limited career advancement opportunities, in there, so it's very uncertain. Then the mental health and stress, the pandemic has exacerbated the mental health issues among university students, including those in medical fields. So there's high levels of depression, anxiety, and stress due to the pressures of pandemic, combined with financial and educational disruptions, have affected students' ability to complete their studies and transition into the workforce. Then the strikes and protests from the Hartal doctor contract.
That's right. Do you believe that it was, did it come to some kind of a resolution or a conclusion, or many of the issues still remaining unaddressed?
Their aim was to highlight the plight of the contract doctors, right?
That's correct.
And demand fair treatment, including creation of more permanent positions and better career opportunities. So I think there was an effect. So it sort of brought up, the what NIC, like the government, is increasing the permanent posts for time being, Yeah. So the strike highlighted the systemic issues within the healthcare sector, right? Further demoralizing current and prospective medical students. You know?
So that could have been the knock-on effect.
Yes, that's
so
right.
What strategies would you recommend then, Dr. Azizan, moving forward so that we can actually address the decline in the numbers of doctors and also the numbers of future graduates who intend to take up medicine as a specialty?
Right. So what MMA has suggested
Right.
about 2 years ago was to increase the contract period of the junior doctors to at least 10 years. So
Understood.
that will give them ample time to do their postgraduate. Indirectly, that will also increase the number of specialists in this country, because 7 years is just too short.
Yes, to also specialize while completing your postdoc.
Yes, that's right. So we suggested to MOH, but I think it was turned down.
Understood.
I'm not sure,
Do you
yeah.
feel a little more hopeful, perhaps looking at the juncture we are at now, that perhaps this will really be reconsidered, because it does seem to be a
Yes.
catch-all solution?
Yes, I should think so. I think, yeah, they should relook on our proposal, actually. Yeah. And then, of course, addressing the well-being of the doctors, so that, you know, we want a positive working environment, free from bully, right? Addressing prolonged working hours, as I was saying, looking at adequate staffing and rest periods to achieve work-life balance. I mean, all this, you know, we are trying to get people back. I mean, we have to improve the system, or else everybody is leaving.
Yes,
so we have to look what is it. And then there was increase in the on-call allowance that has been approved by MOH, I think, in April this year, but has yet to be implemented. We are awaiting for this long, awaited on-call allowance increase.
Exactly.
Yeah.
So I think with the current session of Parliament ongoing, it is quite timely indeed that a lot of these issues are kind of coming home to roost. And at the same time, we do need to be looking at actual strategies that are going to work when it comes to addressing the problem on the ground.
Right.
Dr. Azizan, just one final thought, because you were speaking about the fact that when it comes to being transferred out during your initial years as a houseman or houseperson, there usually isn't a time frame or a time limit that one is allocated. Can this be changed to give junior doctors especially this assurance that they will be, of course, posted back during this frame of time to the main hospitals?
Yes, I think that is one area, I think, for MOH to look into, you know, like posting them out and giving them a definite time frame, you know, and actually also finding out from the junior doctors what is their inclination, what is their medical career pathway. Are they interested in specializing in certain fields, you know, so that they can get to you know, the field that they're interested in, you know, maybe pediatrics or orthopedics, you know. So if you go and serve, because we need to serve rural, you know, because
That's
you have
correct.
to, yeah.
Considering Malaysia's demographics.
Yes. So, and then they'll be getting more points by going there and maybe getting their preference of where they would like to specialize. I think, yeah, they should look into this and get to know every doctor's where is their interest, actually.
Or perhaps even start off with a fixed term time limit, perhaps
Yes.
2 years in the rural before you could be brought back, so that you don't have to worry all that much about approaching your entire family,
Yes.
as well as not understanding what exactly the time frame
Yes,
might
that's
be.
right.
Yes.
Yes.
Fantastic. Thanks very much, Dr. Azizan. We take a brief break. We'll be right back with Niaga Spotlight. Don't go anywhere. Welcome back to Niaga Spotlight. Still with me, Tamina Kauschi. And today, of course, we are discussing on analysis, managing healthcare costs, as well as shortages. Right. Dr. Azizan, so continuing the conversation, now expanding the lens beyond doctors, junior doctors and their concerns, we also are currently in Malaysia experiencing a shortage of about 8,000 nurses for 2023 and 2024. And it's also been projected, of course, that the shortage of nurses is going to reach closer to 60% by 2030, which is not very far away, not even 5-6 years away. So with our aging nation status also being a key concern and the key role which nursing provides as part of healthcare services, what are some of your thoughts about improving this dire scenario for the nursing sector?
All right. For this, I think we need collaboration between public and private. That means there has to be collaboration between both, you see. When you combine resources, expertise, and strategic planning, this public-private sector collaboration can create a more robust and flexible nursing workforce capable of meeting Malaysia's healthcare demands. So it means what? They could collaborate on shared training programs, joint training initiative, standardized curriculum, resource sharing in terms of infrastructure and facilities, funding and scholarships, career pathways and mobility, flexible career options. That's interesting. Everyone is looking at flexible career options. You can do certain hours and So that's something they should know, not very rigid. Continuing education and professional development among the nurses. There's also workforce planning and deployment. So there's coordinated workforce planning, temporary staffing solutions. Of course, you need policy and advocacy, a unified policy development, advocacy for better working conditions. So just like the medical, so I think we have to have this mapping of this data, how many, where and there, and where's the private sector, private and the public, you have to combine the thing and work together. I think it's better. I think I think we have to look in public-private collaboration, I think, to solve issues.
Absolutely. And it's also interesting, Dr. Azizan, that when it comes to the health white paper, which was also tabled in Parliament back almost exactly a year ago in June 2023. Now, of course, we're in June 24. So what were any key areas from there that you see being useful when it comes to PPPs and the balance of resource utilization so that we can actually ensure that these aren't just plans on paper, but that they're quickly rolled out so that we're going to be able to meet those shortages of about 8,000 nurses within the next 2 years?
Wow. So, meaning, how, we are trying to get public-private collaboration here. So, it will be what? The MOH that is going to start the ball rolling or start the communication on how it's going to happen,
That's right.
And we need to know as usual, it's back again to the master plan, that data, how many nurses you need here, which area, which country, so that the public-private nursing schools or whatever, you can organize and say who trains how many and all that. I think everybody has got to come together and make use of the resources, because it's still, so that you can cover out. Else there's certain private school only here, nursing school, and none on this area, and then we need as many also schools, nursing schools, to produce these numbers also.
Exactly.
And, also we have to look also, everything also we have to look at the salary also, because it's a competition with the other countries also. At least a better working environment or other incentives being put in, if we still can increase the salary. But I think we should look at increase of salaries. I think every country, if 2 or 3 years instead of over 10 years or 20 years before any salary increment is being thought of,
Exactly. It's been quite interesting to note that Singapore, in the meanwhile, which is a much closer neighbor, what they have done is offer a good chunk for retirement funds as well as incentives, specifically for nurses, because they recognize the need as being an aging nation. Right. Dr. Azizan, moving into another dimension which has actually opened up as a high revenue and a high growth area, this is expansion of private primary care services. We're talking about private clinics around Malaysia. Tell us a little bit more about the issue of unregulated TPAs. These are third-party administrators, and why this is causing some increasing friction when it comes to affordability of costs, which is slowly going up.
Okay, let me start off. Okay, issue of these unregulated TPAs in Malaysia's healthcare sector started more than 2 decades ago. Okay, the initial objective was better organizing and procuring healthcare services for companies and general population, aiming to reduce healthcare costs. So that was the initial thing. However, due to lack of regulatory controls, the number quickly increased, leading to several problems that have adversely affected healthcare delivery and affordability. So, these include what? They are charging substantial registration fees to clinics, engaging in fee splitting, taking significant deductions from the total bill. So this can compromise the quality of care provided to patients. See, the TPAs are doing that because there's no regulation. So how does this impact the healthcare providers? So it will face financial strain on the healthcare providers, especially the private clinics, because these clinics often rely heavily on payments from the TPAs due to high percentage of patients are from this managed care.
Right, because they're coming streamed via them, and that is
versus
their
the
client base.
cash-paying patient.
Fair
Most of them,
enough.
because they're working with companies and they're being covered by TPAs. So majority of the patients are from the TPAs. And delayed payments from these TPAs will leave many clinics struggling financially, affecting their ability to sustain operations and provide quality care.
Fair enough. Now, with all of these issues that have been observed, MMA has really been at the forefront trying to engage with MOH for this issue since 2015. Sitting here almost a decade on, what are perhaps some regulatory actions that are recommended to bring this issue under control? Because as we can see, TPA third-party administrators are only growing in popularity as most people then are streamed via their employers and their plans into whichever private clinic that they access.
As you've mentioned, we've already approached MOH nearly over a decade already, but they are not, to me, taking active action on how to get them regulated, because they say it's not in the
Scope.
Yeah, in their scope. But
Right.
then in the Private Healthcare Facilities Act, I think it was mentioned, they are placed under Part 15 of the Private Healthcare Facility Services Act since 1998. However, till now, there is no regulation. Hence, MOH unable to enforce and no action has been taken. So actually, nobody is actually looking into it, how to get, how for them to able to regulate. Everybody is not saying it's not under them.
Understood. So basically, it is something which is floating, but at the same time, it is
Yes.
impacting rising costs
Yes.
for those who are paying out of pocket.
Right.
Moving into some closing statements and ideas, Dr. Azizan, what are your suggestions for healthcare sector focus issues that must be raised in Parliament, hopefully during this ongoing session?
The key healthcare issues that we would like to raise during the ongoing Parliament session, one is revamping the Act 586. Okay, that is the Private Healthcare Facilities and Services Act 1998 and its regulations, enforced since 2006, currently impede the growth, cause inefficiencies, and increase the business burden. So our recommendation is to propose a major overhaul of the Act, transition to a comprehensive health services Act that regulates both private and public, to ensure patient safety and quality care. That is one. Of course, as we were talking just now, to regulate the TPAs, the third-party administrators, that need to be controlled because the TPAs are controlling the employment health benefit in the country amounting to more than 1 billion RM.
That is no small amount. So it
Yes,
clearly
that's right.
requires a unified system to register clinics.
So there is that part 15 I was saying that they could look into that, all right? Then addressing the healthcare manpower shortages. This is affecting service delivery and operational efficiency. So we recommend that MOH should prioritize and publish a national manpower distribution plan. That means we advocate for a 30-year blueprint for healthcare manpower planning to anticipate and meet future healthcare demands effectively. So you need to really plan ahead for all these things, right? And then the reforming of health financing. The current tax base, right, is not sustainable in the long term. So we recommend for the government to initiate discussions in Parliament on alternative health financing models.
Fantastic. Dr. Azizan, this has been such a rich discussion. I wish we had time for a little bit more, but that's all we have time for today on Niaga Spotlight. Here's to meeting you again next Friday with more business analysis and highlights. Here's to a productive week ahead.